So welcome back to Drug School, and my name is Adam. I am pleased to have another farm tech who is also a Master of Public Health with me. This is Michelle. Michelle, why don't you go ahead and introduce yourself, how you got into pharmacy, how you ended up in public health, and whatnot.
Okay, well, hi Adam. It's a pleasure to be on with you. Thank you for having me. So thinking back on my pharmacy tech career, I actually started out in retail. So back in the day when Eckerd was around, I know I'm kind of dating myself. I started off as a pharmacy clerk. So initially, all I did was complete the transactions at the register, and I ranged patients out, and then eventually I progressed on to Kroger, where I actually became a pharmacy technician and took on a more traditional role of a pharmacy technician in a retail environment. From Kroger, I went on to one of the largest hospital systems here in metropolitan Atlanta, Grady Health System. And then from there, went to Walgreens, had a great experience working in their district office and as a pharmacy tech in their stores. And then from then, I went into pharmacy education with Corinthian colleges, and then to West Georgia Technical College. And now I currently work as a student mentor or a student academic coach. And through that whole journey, I started off at a small college, Atlanta Metropolitan College. It's like a community college. And then I went and got my bachelor's from Herzing University. And eventually I obtained my master's degree in public health with a concentration in health informatics from Augusta University. So it's been an exciting journey.
Informatics is actually one of the classes I have next semester. So, um, that'll be interesting. I just bought the book for it. It's sitting over in the corner over there. It's interesting you worked for Eckerd. So back when I was an undergraduate student at Western Michigan University, I worked for J.C. Penney selling shoes. J.C.
Wow.
Penney was the parent company to Eckerd. So you and I were working for the same company at the same time.
Yeah, it was destiny that our paths would cross again.
Even though we weren't even in the same state. That's
Yeah.
fascinating. So what got you into pharmacy in the first place? How did you, I mean, what was the driver for getting into pharmacy?
Well, as a high school student, I was intrigued by what the pharmacy technicians did. And initially, I wanted to go into nursing, I wanted to go into healthcare, but then I realized something about myself. I don't really like touching people, and I don't really like touching sick people, and I don't like touching sick people with bodily fluids. Like, I can handle the sight, but I don't want to be a part of the experience. So one of the things I love about pharmacy is that I'm in healthcare. It's a respectable profession. I'm helping people get well. I'm impacting their lives for the better, but it's totally hands off. On a very rare occasion do I have to touch a patient, and usually it's not a situation where I must touch a patient that is in some type of undesirable condition. So that's the part that I like about pharmacy as opposed to other areas of healthcare. I'm helping people be well, but hands off.
Okay, so what was the oddest thing you've ever found on a prescription?
Oh man, I've seen like one time this lady, it was a drive-through pharmacy, and she came up and she literally had a bucket of chicken in her lap and was eating like this greasy fried chicken, and then handed me her prescription with chicken grease on it and chicken crumbs. And I mean, I thought that was gross. And then the other thing is, sometimes when patients will have dental work done, and they would come from the dentist, and for some reason they thought that was an excuse to just hand us the most soiled prescriptions with blood. It's like, no, I know you went to the dentist, but it's not okay to give me a bloody prescription. So I actually had to put on gloves and go get a Ziploc bag and put it in there. Between the blood and the fried chicken, I don't know, it's a tie.
I've had the blood. I don't know. I'd have to think about what my other odd one was. What was my other odd one? I know I've had somebody spill Starbucks all over their prescription in an effort to bleach it out.
Goodness.
And it actually caused a chemical reaction with the paper, so it like bleached out all like the drug name and everything, and it was a mess
Mm,
because coffee's so acidic. It changed the chemical construct of the paper. It was
well,
lovely.
tamper didn't.
Yes, exactly. So you got your master's in public health, which is what I'm in school for now, and I think they're slowly breaking me down inch by inch. Have you yet had a moment where the clinical side of your head and the public health side of your head have actually been in conflict with each other?
I think the only conflict that I've seen, and this is probably more so recently, is why is there not more of a collaboration between public health and pharmacy? It seems like such a no-brainer, especially since we're in constant interaction, pharmacy as a whole, with the general public. Just like the general public goes to see a physician
Mm-hmm.
who will help to, diagnose their condition and then prescribe a treatment. When they go get a treatment, where do they come to the pharmacy? It just seems like a natural progression that we would have some type of merger, collaboration, or integration of public health into pharmacy, centering on and around pharmacy technicians, especially with the pharmacy technicians nowadays who have such advanced credentials, and with the advancement of the pharmacy technician profession. It just seems so natural. It's like, oh my gosh, does anybody else see this? But I think that's probably like the biggest thing that's glaring right now in my face.
Yeah, I actually I actually had this clinical argument with myself, and I actually ended up going back to my epidemiology professor.
Hmm.
In our program, we had the same professor for biology, epidemiology, and environmental health,
Hmm.
which was great because we had her for 3 semesters. You got to build up a great relationship with her, and she used to run a nonprofit out of Philadelphia, and the school I'm going to, which is Western Michigan University. She came to us and she goes, "Yeah, I have all of this knowledge about hepatitis and HIV and all of this fun stuff." And I started having this clinical argument with myself on HIV pre-exposure prophylaxis because the clinical side of me is going, "This is an antimicrobial disaster zone," and then the public health side of me is going, "But you're preventing an infection." So,
Yeah.
and I'm sitting there having this argument with myself, and then I got assigned to write an article for MPA on pre-exposure prophylaxis, the Michigan Pharmacists Association.
Oh,
So,
wow.
to educate pharmacists about what PrEP is and probably
Hmm.
why they will never see it, but why it's important that they know that it exists in the market or in the world. And
Hmm.
so I'm having this internal clinical argument, and I went back to her this fall, and even though I didn't have her this fall, I'm sitting there going, I'm having an argument with myself, and she goes, "Okay, I know nothing about pharmacy," and I said, "You don't have to. You just need to talk me off the ledge."
Uh-huh.
And she goes, "Well, okay, what are your clinical concerns?" And I'll like be devil's advocate. So she and I sat down for an hour after our face to face this fall, one of our 2 face to face sessions, and she let me have this clinical argument out loud, and she played devil's advocate with me, which was real fun to do. And so I'm starting to slowly like get into like we have a general MPH, so um, we so we take a little bit of everything and then we blend them all together and make a public health degree.
Hmm.
And so I try to take a key takeaway from each class and then try to like build on them.
Hmm.
And so like epidemiology was okay. One study does not causation prove.
Hmm.
Is basically what you get out of that class. Environmental health, I got a separate takeaway, and then I will never work in environmental health. Um, there was a lot of gross stuff in that class. I just know, just like your bodily fluids. They had one of our guest speakers was a sanitarian from our county health department.
Uh-huh.
Do you notice? Have you ever heard what a sanitarian does?
I have never heard of a sanitarian, but I was thinking maybe they focus in sanitary practices.
Okay, so you're not far off. You're not far
Okay.
off. The sanitarian goes and they do restaurant inspections.
Okay.
So from the county health department, they go out to restaurants, make sure that the food that they're serving is safe for people to eat.
Adam, my stomach is turning already. I'm already one of those picky people.
It
But
gets
go ahead.
it gets worse.
Okay.
So Kent County is Grand Rapids is where I live in Michigan is one of those cities where you can drive about 10 minutes in any direction and you're in the middle of nowhere.
Mhm.
So from downtown Grand Rapids to 10 minutes in any direction is like basically farmland. So the other job a sanitarian has, oh wait, there's two more gut wrenching jobs. They do septic and well inspections and
Oh my.
certify them according to the building health code.
Okay.
And the other gut turning job, we have a task force on hoarding
That's
in
a
Grand
real thing.
Rapids. And that's a real thing. But the pictures on that PowerPoint were like, you've got to be kidding. People live like that.
And
Seriously?
the part that probably made it most concerning is that people live like that in my community, not like across the nation, but like nearby.
Oh yeah. This is a collaboration with our health department, our sheriff's department, our building code and inspection department, um, and then Pine Rest, which is our big mental health facility up here. They all collaborate together and they get the people treatment, they clean up their house, they renovate it back into code.
Wow.
They work with people to donate time and effort into getting the house back into a livable state, and then get these people mental health services. So it's an interesting concept, but you'll never catch me being the one person that goes in there and has to tell them that their house is condemned. Because
Yeah.
no.
Yeah. That's rough.
Because like you, I got into medicine, or I got into pharmacy because I looked at every other medical profession. I'm sitting there going, I cannot stab people with needles. Don't make me see blood. It's bad enough when people go, "Is this rash infected?"
Yeah. Is it contagious?
It's like, no, you're fine. Let me get a pharmacist. But but I agree with you. Pharmacy does have its place in public health, and I'm getting actually ready to write a CE. I'm actually presenting a CE next May about how pharmacy can get into population health, which is really fascinating. And so, what do you envision if you could picture pharmacy practice getting into public health? What do you think it would look like?
Well, I feel like one of the greatest opportunities definitely is going to be point of sale within the retail environment. And I'm thinking, even in terms of public education going beyond, have you had your flu shot today?
Oh yeah.
Um, and I think that pharmacy technicians could really take on that role, especially when you consider what they do. And I believe is it Idaho or Iowa?
I,
I'm gonna say Iowa, where they pharmacy technicians give immunizations.
Idaho, Rhode Island, Connecticut.
Idaho. Okay.
Those three states allow you to immunize. Michigan has a weird way of doing it
Hmm.
because we immunize through collaborative practice agreements.
Hmm.
You can write a pharmacy technician into a collaborative practice agreement. So
Wow.
so we can kind of like sidestep our way
Hmm.
into immunizing in Michigan. So um, it's the backwards delegatory authority.
Hmm.
So a pharmacist in Michigan can only delegate 6 things to us,
Hmm.
but a doctor can delegate anything they want to.
Wow.
So as long as the doctor feels that they have the right training and education and certifications and whatnot, they can delegate anything they want to any member of their staff, as long as it's, within reason. That's why you have receptionists who call in prescriptions who can't tell you a drug name to save their life. But um,
Yeah.
uh, um, it's the doctor having the ability to delegate to a technician.
Mhm.
And I actually did have in Michigan. We can actually practice under doctors too, which is also real fun. So we can actually go into like primary practice,
Mhm.
and our hospital up here just did something really fascinating with the practice of pharmacy. In their internal medicine practices, they
Mhm.
have a pharmacist and a pharmacy technician working in primary care.
That makes complete sense to me. And I think I kind of think about the Kaiser model, how everybody's housed in the same building, but even taking that a step further and putting them in the same office space or in very close proximity.
Yeah, so it makes for a very interdisciplinary approach because you have pharmacy technicians who can do a lot of the prescription grunt work, tracking down prior authorizations, getting copay cards where needed, helping out patients with getting prescription refills organized, or getting uh, the pharmacist ready to take medication therapy management appointments and all that stuff. They have a technician that does that, and then doctors can also delegate other tasks too. I don't know how much you delved into my channel, but there is a pharmacy technician on there that works in an oncology clinic under a doctor,
Hmm.
and his name is Jacob. I actually Volin told him to do something for the Michigan Pharmacists Association coming up in February. So, um, but he does stuff like getting nutritional therapy
Hmm.
for his chemotherapy clients.
Wow.
So he got a whole bunch of samples from like Nestle, Ensure, so that
Hmm.
his chemo patients could get some nutrition while they're nauseated all the heck. So um, I thought that was an interesting way, and I never thought about it as the Kaiser Permanente model.
Hmm.
Um, the health system that does that up here in Grand Rapids is called Spectrum Health, and they also own an insurance company called Priority Health.
Hmm.
So they're like extremely vertical in the way that they integrated their health system. So um, they practice a lot of population health, which is really fascinating. And
Hmm.
have you ever heard of diabetes education and type stuff?
I mean, I've heard of it. I've even heard that there is a diabetes education pharmacy technician or pharmacy technicians that specialize in diabetes, and working with people with diabetes or healthcare providers or systems that focus on diabetes care. But I've actually never seen it or explored the model, or I've never seen it. I've heard of it, but I've never seen it.
So this was a wild technician thing, and you'd love to hear about this. The the pharmacist and pharmacy technician can actually split roles in diabetes care.
Okay.
So pharmacy technicians can actually take a training course and teaching a program by the Centers for Disease Control and Prevention called
Uh
Prevent T2.
huh.
They're allowed to give that. No, there are no certification requirements required other than taking a training course for it.
But Adam, doesn't that seem like a natural partnership since we're the ones dispensing the supplies? Usually the patients, since we're the first point of contact when the patients come in between the patient and the pharmacist, it seems so natural because think about, I don't know if you've ever worked retail, but I'm
Oh yeah.
reflecting on how many patients who I dispensed strips to who had so many questions, or who I dispensed Lancets to, or who were getting glucometers for the first time, or just started regimen for type 1 or type 2 diabetes. it's a natural interaction, and it's like, why not educate these pharmacy technicians on diabetes education for the patient, or use them to be an advocate for healthy living, healthy lifestyles, or healthy practices, or whatever it takes to make sure that we're trying to increase patient compliance and improve patient outcomes. Like, why not?
Absolutely. But yeah, so we have all of these patient interactions,
Hmm.
and you're right. Who better to provide those patient interactions?
And I think one thing that's in our way, Adam, is sometimes there's a stigma that comes along with the general public perception of being a pharmacy technician. I feel like this is something that I've encountered working in pharmacy technician education, is that people outside of pharmacy world really don't understand the advanced roles and the hidden roles of pharmacy technician. They're like, all you got to do is slap a label on it or count by fives. I'm like, no, that is not what we do. So I think that getting those advanced opportunities for us is really a matter of pharmacy technicians advocating for what we can do and educating the health community about how we can help advance health initiatives overall. Because I really think that they really don't know. Even when I would tell people that we had partnerships and we worked with a nuclear pharmacy, they're like, nuclear pharmacy? I've never even heard of that. What's that? And I'm like, well, you'll never see it advertised, but it's there. So you don't see the win, but it's there. You feel the effects of it. So I think a big part of that in terms of advancing and getting these opportunities and helping to make a big impact in public health is us advocating and educating on what pharmacy technicians do and who we are.
I agree, and um, I actually, one of the two boards I serve on at the Michigan Pharmacists Association is the Consultant and Specialty Pharmacists of Michigan. I work in managed care now. I was a retail tech for 11 years. About a year ago, I got out of retail, and I work in managed care now. And I don't miss retail, for the record. Um, but
Most people.
it's
Moving on.
yeah. Moving on. But uh, I one of the guys I serve on the board with is a pharmacist by the name of Alan Doan, and he actually operates a company called Hot Shots, which is a nuclear pharmacy. I just thought the name was fascinating.
Yes. Because when something is radioactive, don't they refer to it as being hot, right?
Yeah, exactly.
Okay.
So, I mean, I remember Chernobyl back in the 80s, so um,
Uh-oh, you're dating yourself.
I am. The gray in here doesn't give it away. Um,
Blending in with the background.
that's why I painted the wall red.
Yeah.
Um, but so consultants and specialty pharmacies. I have a pharmacist who works for the Ford Motor Company on that board, and I'm the only technician right now because I'm our technician liaison. But it's fascinating how many different practices of pharmacy we actually have. And I was on a podcast called The Business of Pharmacy with Mike Kelzer about a month ago, 2 months ago. And I said there's a fourth practice of pharmacy. We have the three standard ones everybody thinks of. We have retail, long-term care, hospital, the three standard.
Yeah, somebody called it the Holy Trinity.
The Holy Trinity of pharmacy. And I said, I'd argue there's a fourth practice of pharmacy called public health pharmacy.
Wow.
I have no idea what that looks like yet. I'm curious. Do you have any thoughts about what a public health practice of pharmacy would look like?
I think it goes back to, and maybe this is me thinking as an educator, but I really think it goes back to patient education. And I'm thinking one of the closest ties is probably immunization. So, disease prevention and education on some of the major risk factors or some of the major which diseases causes, have the highest rates of mortality, and maybe even being a little more specific among those demographics there. So if you're in a community where there's a lot of heart disease, then specializing in heart disease prevention or heart wellness and messaging that to the community, because I think that sometimes we always look for a large entity to reach down and have a big impact on the smallest components of that community, but really us being individuals in the community, we have the greatest impact. So I say that to say it's not, I don't think the answer is like big government creating a program or a big hospital system creating a program. That maybe public health pharmacy starts with community pharmacies taking the initiative or doing something innovative and creating roles for pharmacy technician where we are educating and advocating. And that's I think that's how we gain respect within our profession and within our community. I think it really goes back to educating and advocating, not just for pharmacy technicians, but for community wellness. We're the ones who have a rapport with these people who make up communities. So we really have to make sure that we're doing our due diligence to make sure that we're giving them the best possible outcome while educating them about wellness.
Absolutely. And I agree with almost all of well, actually, I agree with all of that because chronic disease is probably the biggest thing, because you have diabetes. 1 in 3 adults, what is it? 1 in 3 adults is pre-diabetic. 9 in 10 don't know it.
Wow.
1 in 6 Americans have heart disease, and an overwhelming majority of them don't know it. So I think it is that prevention piece, and possibly education as well. And hopefully we can get somewhere with those. So if you were a pharmacy technician and you wanted, well, let me rephrase that question. Because you have a network of people of technicians who are doing some fascinating work. I think I saw
Like
someone
you.
like me. I saw one of your friends works for the Fulton County Health Department now.
Yes. Yes.
That was, I think it was Demetrius, wasn't it?
Yeah. Okay. Yes. Demetrius Mosley. Yeah.
Um,
And
and
and I think previous to that, he did some work within HIV, if I'm not mistaken, as well.
Interesting.
Yeah.
Yeah, I'm trolling you on LinkedIn as we're recording a video. Um,
Another colleague of mine, Robbie Howard, she has a master's in public health. Actually, she's almost done with her doctorate in public health, and she was in pharmacy technician education, and now she's moved on to doing training within PBMs. So her role is really interesting. Um, but yeah, I do know a couple of people who who have credentials in public health who work in pharmacy. And then just in general, people who have non-traditional roles in pharmacy, like pharmacy has changed so much, and I'm so grateful for those who have fought for the advancement of pharmacy technicians, because you're seeing their work come to fruition right now. So I don't want to start dropping names because I don't want to leave somebody out, but there's so many people who I think who have empowered me to move forward and choose the path less traveled to affect change within the pharmacy technician community.
oh, absolutely. I think the one sentence that always makes my blood boil is, "I'm just a pharmacy technician." Oh, good. It makes your blood boil too. Good.
Yes, foolishness, Adam, foolishness. It's like saying all I do is save lives and change the world. Nothing important. Like what? Do you know what you just said? Like, don't ever detract from your value, you know, because you help set the bar as to the value that you bring to the table. And I think if we really was to dissect it and break it down what all that we do, we will realize that we have so much worth. But if we don't see it, if we don't actualize it, you know, we don't put it there on display for people to see, then, you know, they won't know it.
No, they won't. And um, yeah, I started. So I work for the company I work for now is actually technically a corporate health and wellness firm. So our bread and butter business is we go out, our wellness department goes out and does like health risk assessments for companies that fund their own insurance. So they
Hmm.
try to determine what the risk pool is, and then they try to lower their risks.
Hmm.
And then we do a little bit of work on the insurance side in trying to contain the cost. So we have nurses who do utilization review, and then there are two of us. I actually got to hire somebody in July. That was fun. Um, so there are two of us who do. We run a pharmacy savings program. So we help the insurer maximize, manufacturers' coupons to help get savings for both their members and their health plans. So it was a fun thing to create.
Hmm.
And I walked into that job and like nothing existed in how to structure this program at all.
Hmm.
And I had to walk in. I had to put on my information systems hat. I had to put on my program management hat, and I had to go in and like set this whole program up so that I could scale it and make it useful for multiple companies. And when I started the program, I had three groups. I had three groups I was working with.
Hmm.
I now have, well, starting January 1st, I will have 18 groups in my program, 18 employer groups.
That's amazing.
Um, and then I started going, okay, well, how can I put this program on steroids?
Hmm.
And I came across an interesting practice of pharmacy, and it's charity pharmacy.
Hmm.
Have you ever heard of one?
No, tell me more.
So there are charity pharmacies that exist in the world. I think there are 18 of them that I'm aware of. And I'm actually a member of their organization because the parent charity to drug school, which is Compassion RX, their ultimate goal is to actually start a charity pharmacy in West Michigan. We have one in Kalamazoo, but it only works towards clients in a particular health system in Kalamazoo. But they are set up so that they give away medication.
Wow.
So people who are uninsured or they don't meet Medicaid guidelines, so they can't qualify for Medicaid, but they don't make enough to afford their medication.
Hmm.
They can go to pharmacies like this, and if they meet the criteria for the donated medication that the nonprofit sets up, they would just get their medication for free. And they get donations from drug manufacturers. They have a network of clearinghouse nonprofits that they get donated medication from,
Um,
and they give away their medication.
that is absolutely amazing. That is the embodiment of community.
And I've been working with a pharmacist out of Bridgeport, Connecticut, and her name is Christine Toney, and she operated one of these dispensaries. It was called Hope Dispensary of Bridgeport, Connecticut. And it's still around. They just actually expanded their facility. They were actually in their original pharmacy was in the basement of the county health department in
Wow.
Bridgeport. So they worked out of like an office suite in the county health department, and they grew out of it and had to move down the road. But
Good news.
well, it's good and it's bittersweet news. It's it's good news that their program's expanding. The bad news is that that need actually is there,
Yeah.
and but they work very closely in getting free medication for people. They'll go to doctors' offices and get their excess samples.
Mm.
So they go raid the sample closets of every doctor, or they'll have a network of doctors who will order samples for them, and if they can't get it that way, they'll go to the pharmaceutical manufacturer patient assistance programs
Hmm.
and get their medication that way, or they'll set up a bulk agreement with a
Hmm.
manufacturer. So let's say they want to dispense albuterol inhalers, and
Hmm.
they know they need 100 of them a month. They can set up an agreement that they'll get 100 a month from the makers of one of the albuterol inhalers, and then they'll just get those donated every month and then give them away. And it is the embodiment of what I've gone to public health, into public health for, is okay, I know my community needs public health people, but I need to do something that's unique to the practice of pharmacy because there's so few of us that are floating around that are pharmacy oriented. And so I'm working on trying to actually get that set up. I'll probably be one of the few technicians you'll ever see own a pharmacy. But
We're not going to limit ourselves by saying that. You may be one of the first, but just know that you're setting a precedent that what you're doing, you're blazing a trail for someone else to follow. So
absolutely.
I commend you on doing that.
So that's my ultimate goal. Need a $500,000 grant to do it, but that's the ultimate project of this organization, and it's interesting. So you got into public health. What you got into public health via a master's program. What was your favorite class in public health when you were
Mm,
going through your MPH?
you know what? From an interest standpoint, I think the informatics, like building databases and disseminating information, like finding the information, sorting the information, organizing the information, and then putting it into a format that's useful for like data interpretation. Um, but then like the hardest one, the one that I'm trying to think, did I literally cry? It made me want to cry. I may have actually shed tears. Was biostatistics. It, like I thought I was going to lose my life. Like biostatistics had me on my knees, had me on my face. Like biostatistics was such a challenge, and the what made it even more frustrating is I feel like I had such a great instructor who was such an innovator. She presented it in such an innovative format to where she built the biostatistics course like you were watching a news broadcast, and so the concepts that she was teaching was like via news updates with like live video. It looked like you were in some type of emergency situation in the background, and with a newsletter and bulletins. She built it so well, and it was so engaging. And I struggled so much. Biostatistics. I mean, it was valuable. You need to know those concepts. You need to know what's statistically relevant and how to calculate different formulas and everything. But I nearly lost it due to biostatistics.
I think I have my cohort, my class at Western is a class of 19,
Hmm.
and I think 16 out of the 19 in my cohort would agree with you.
Yeah.
um, the In my master's program, in the new version of the program that I'm taking,
Hmm.
we actually take They are now just now starting to teach epidemiology and biostatistics together.
Mm,
So they're one in the same class.
mm. I'm not sure how I feel about that, but you know how some people may feel some way about this, but there's a saying in academia, right? You know, you have to maintain a certain GPA to remain within the master's program and it's competitive, right?
Right.
But there's a certain saying, and the saying is C's get degrees too. And I was trying to tell myself, I know this is against the program parameters, but if I can average it out with a bunch of A's, I'll be okay with a C. You know why? Because C's get degrees. It was rough. It was rough. And when I went through the program, I was pregnant as well. So I actually gave birth during my final semester and did one of my finals in the hospital. Like I had a baby and finished my MPH at the same time. So maybe that was it. I don't know. It was rough. I'm just glad I got through it. Done.
Um, I think the class I loved the most. Um, uh, so far, the class I liked the most, and it probably frustrated me to death. I actually did like epidemiology.
I did too. Okay. I can see. I can see.
Um, I liked it. I don't think
Uh-huh.
I could do it as a career,
Uh,
but my problem with that class, and it frustrated me to no end, was is I kept wanting to say X caused Y, and then like not be able to say, oh yeah, but I controlled for Z, X, Y, Z, A, B, C, D, E, F, and G. When we got into analytic epidemiology, I kept going, I can't get this. I just cannot get this concept. And finally, I pulled out. We had to do our final project for that class. We had to do like a review of a paper we read.
mhm.
So I found this study on the antiviral effectiveness of oseltamivir, otherwise known as Tamiflu.
Uh-huh.
And it was a study that talked about how Tamiflu is really, really effective if it's administered within a certain amount of time while the patient's in the ICU.
Uh-huh.
But the study was so oddly configured, it left a lot of interesting questions to be answered. And one of the things that they did in the study is they found out that oseltamivir works great against H3N2 flu.
Mhm.
If you have H1N1, you're screwed. Um,
Oh,
so oseltamivir has a lot of H1N1 resistance.
wow.
They found out that a lot of the H1N1s died, and I'm sitting there going, oh, that's not an overwhelming, resounding advertisement I would give on Tamiflu, but
No.
I kept wanting to go, oh, it works great against H3N2. And she's like, you're right, it does. But you didn't consider all of the arms of the study, and there were like 26 arms of the study by the time I got done reading it. I'm like, good lord.
Mm.
Um, but my second favorite class is one I actually just got done taking, which was education and promotion.
Oh.
Kicked my butt too. That class kicked my butt. That
I
one
think,
in, that one in public health communication strategies both kicked my butt. The problem is I just got done taking both of those classes.
well, the good news is now that you passed it, you're done with it forever. I mean, like you never have to take the course again. So.
Yeah, it'll be interesting to see what I have. I have a internship and 2 classes next semester.
Mm.
So we're doing emergency preparedness,
Hmm.
and we're doing informatics, which is your love.
Yes.
It may become my love. I don't know. The professor that's teaching it actually works for the Kent County Health Department, so
Yeah.
that'll be interesting. So, um, and if you had any thoughts about what a pharmacy technician wanting to get into public health would do, how would you encourage them to get into it?
I would say envision the role that you want and go after it, whether it already exists or whether you have to create it. I was at a meeting about 2 months ago, and I met a really amazing individual. Um, and I was talking to him about, some of the limited roles of pharmacy technicians are offered, and he was like, "We have to create it." And he his encouragement was so strong that I literally went back and was like, okay, what can I create? What can I create? So if the role that you envision, if the role that you see is not there, then literally go after and create it, because your experiences are valuable, and you don't want to detract from that valuable from thinking that you're not good enough or that you can't do it. Go after it. Even if your skill set doesn't match exactly with the job description, let them know the value that you have, because a lot of people outside of pharmacy have may have limited knowledge as far as what pharmacy technicians do, or if you're in one specialty or profession, you're not familiar with what the other specialties do. Even talking, I referenced a nuclear pharmacist before. He was like, if I went to CVS, I wouldn't know what to do. But yet he's been a pharmacist for about 20 years, but his specialty is nuclear. So don't be afraid to advocate, educate people on what it is that you do. Share your strengths, show them your strengths, and they will respect it. And, show them your value, and the opportunities will come. I strongly believe that. But whatever you envision in terms of your role in public health, be involved, be a part of the organizations where people are having a seat at the table and talking about public health and pharmacy, and make yourself part of those discussions, because you definitely have so much to add to the world of pharmacy and public health. And I believe in merging those two worlds. It really starts with us as pharmacy technicians. So go after the opportunities that you want. When you see an opportunity for a niche to be created, go after it, and believe that you do have value, and share that value with others, because they're willing to listen.
I believe that too. While you were talking about that, I had an interesting thought, and um, getting out into the community organizations.
Mhm.
And one of the practicum sites that I had considered was working with doing patient advocacy work for a set of clients for a food bank. So taking the least health secure, food secure people and trying to find them healthcare resources that can help them with their healthcare needs, or helping them find ways of managing their chronic illness affordably.
Mhm.
And um, I didn't end up. They stopped returning my email, so I didn't end up getting a practicum site with them. But um, getting into some of those organizations with pharmacy technicians would be an interesting place to start, just to see what the health needs of your community are,
Mhm.
and then trying to bridge the pharmacy need gap.
Yeah,
Yeah.
you had a very valid point. It really starts with volunteerism. So, the first opportunity to collaborate may not be paid, but serving on people are usually looking for people to participate on their advisory boards or the governing boards or various committees. I've served on various advisory boards, or adoption committees for curriculum, for health curriculum and things of that nature. But it's really about getting out there. Like sometimes people say, how did you get this opportunity? You would be surprised how much comes from just pounding the pavement, like literally going to see somebody who you've never met before and just putting yourself out there and saying, hi, I'm Michelle. My passion is public health and pharmacy. Not like that, of course, but it really does open doors when you just, it takes some vulnerability, but just have that confidence that the experiences that you have are valuable. I just can't emphasize the value that each one of us possess enough.
I agree with you, and I think that's a great place to close. And
Mhm.
Michelle, I really want to thank you for joining us on Drug School today. It's been very insightful, and hopefully you gave me some words of encouragement to make it through the next 3 semesters
You
of
could do
grad school.
it.
Uh,
You could do it.
August 22nd, I have a countdown calendar out to August 22nd. Um, so thank you very much for joining us, and I appreciate you having us. And if you'd like to donate to Compassion RX, which helps fund drug school, we'd appreciate it. Well, you don't have to do that, Michelle. You can if you want to. But
By example.
there'll be a link in the video description on how to do that. So thank you,
Okay.
Michelle, for joining us today. We appreciate it.
Madam.